can now program that it is an LBBAP pacemaker, that the patient has a left bundle branch area pacing lead. I think this is really important because in our regular daily routine we now see LBBAP patients and regular RV pacing patients amongst each other, and when it's not mentioned on the first screen of the pacemaker, you need either an ECG or you need to check the patient file to find out what kind of pacemaker this patient has. So now that we can mention that the patient has an LBBAP lead, so the first look you have on the screen and you know immediately what type of device and what type of lead is inside the patient. I think the evolution now that the automatic MRI mode can be turned on for a whole year is a big improvement, because we have now a long time window that even spans beyond our regular outpatient clinic checks in the patients. So, which means that the device is always in auto MRI mode, and the patient can go to any MRI scan that is necessary without any interfering or any activities on our side. So I think that is a really good improvement. Now that we also have the printed document that states that the patient is safe for MRI, that the dates are clearly mentioned, this will also help in the future, and I then also talking about the longer term, to get the radiology doctors to be more confident working with patients with devices. By using the new tools and settings in the Amvia Sky pacemaker, I think we can alleviate this fear that they sometimes have for device patients also in the long term. So I think it's the way to go forward. With the advent of the quadripolar leads, we have now a lot of options for left ventricular pacing. A lot of vectors are available, and it can be quite cumbersome in the outpatient clinic to check everything manually and to find out which one is the best for the individual patient. So now with the automatic option, of course, it's very interesting that in a short time frame you can get the automatic results for all the available pacing vectors. So it will improve on the time frame of the outpatient clinic. And when you combine this with the auto adapt feature, of course, we are not only choosing the best situation at the time of the control in the outpatient clinic, but also when the patient is later at home. The device is continuously choosing what is the best programming for the patient at that moment, choosing between LV only pacing, biventricular pacing, adapting the IV delay shorter or longer to the specific situation where the patient is in at a certain moment. So it's not only an advantage in efficiency for our workflow, but it's also an advantage for the prognosis and the quality of life of our patients. Closed loop stimulation is very helpful for our patients with chronotropic incompetence, but the special feature is that it's also reacting to emotional stress because it's based on the contractility of the heart. And I also think it's a very interesting feature for patients with vasovagal syncope, because in this type of problem we can reduce the number of syncopes up to 80% by using the closed loop stimulation feature. The quick check, I think, is very interesting because it allows you at a certain moment that you would want to see some data to get it immediately. That's very interesting. It can be a patient who makes a call that have felt this, have felt that, and you want to know what is going on, so you can do the quick check and to have an immediate result and know what is the best decision in a certain situation for that patient.